Hospital beds across the country and here in Idaho are filling up with patients fighting the flu, COVID, or RSV, the so-called triple-demic.
And it looks like that triple-demic will last and possibly get worse through the holidays.
News Channel 7's Jude Binkley heard from some of the state's health experts during a briefing this afternoon. Jude, what did they have to say?
Well, Doug, the director of Idaho's Department of Health and Welfare said they're concerned about seeing the three respiratory diseases circulating at the same time. And they say that a bigger surge could be in the making after the holidays.
Unfortunately, we have seen our concerns turn into reality, creating something we call the triple-demic.
Influenza, RSV, and COVID. Sustained levels of the three diseases have led to a unique situation this year. And while data shows RSV may have hit its peak, influenza may not have. There have also been sustained levels of COVID above the Department of Health and Welfare's 5% target.
This is significant because this is the first respiratory disease season we have had during which both people admitted with confirmed COVID-19 infections and confirmed influenza infections have been this high at the same time.
The nationwide issue putting a strain on hospitals' resources.
Let me be clear, hospitals across the state are full and under a tremendous amount of stress. Following the Christmas and New Year holidays, we expect to see another surge in hospitalized patients.
To meet demands, hospitals like St. Luke's have had to flex their resources. They've also opened up respiratory outpatient clinics for the first time, but patients should still expect to wait.
If you need to be admitted to the hospital, you might experience needing to board in the emergency department, which means spending more time in the emergency department before we are able to open up a hospital bed. Your care might occur in a different place. The drugs and supplies we use might be different, and we might even need to cancel elective surgeries.
Symptoms for the flu and COVID can overlap, so if you get sick, it's hard to tell which disease you have. The viruses can also affect people very differently. And as for what steps people can take to protect themselves,
I have three things I'd like to emphasize, and those are knowing your risk for severe disease, knowing if you're at high risk, being ready to test if you get sick so that if you are at high risk, you can get tested quickly. And then also knowing to ask whether antiviral treatment could be the best thing for you if you do test positive, whether it's for flu or for COVID. There are antiviral treatments for both.
this increase in demand has also caused supplies at local hospitals to get sucked up. St. Luke's says they've had to ration but not restrain some medications like children's Tylenol and ibuprofen. But the state epidemiologist says that doesn't mean there's an actual shortage of these drugs.
Just being careful with what they have. Jude, thank you.